Hello, I'm Rick Watson at Eagle West, and you're listening to one of our series in Client Stories. Today I'm speaking with Miles Tashima. 10 years ago, Miles, a Kaiser doctor, was faced with becoming disabled, confronted with financial and emotional challenges, and some unexpected benefits. We all maintain great hope for the future. Miles, please begin anywhere you'd like in sharing this story.
Hi, my name is Miles, and I'm going to talk about what I went through about 10 years ago when I was faced with a long-term medical disability. My wife and I were at a quandary as to how to approach it, and it was scary to suddenly think that things would have to change.
Just give us a little bio about you, who you guys are.
I am a urologist. I'm married with 2 children. My oldest is a junior, and my youngest just started her freshman year here in the Bay Area.
Great. All right, so tell me about, how did you find out about your medical condition?
My father had passed away from prostate cancer. I thought it would behoove me to screen for it also, and to my shock, I was found also to have prostate cancer. That started the thought process of how best to be treated. I thought surgery would give me my best chance of being cured and to get back to work as soon as possible. So that is what my wife and I chose. Despite that, within the year of having had surgery, my PSA started rising, and further investigation found that I now had metastatic prostate cancer. After going on hormone therapy, the physiological side effects were so great that I no longer found myself able to maintain the pace of a full-time surgeon, and had to first give up my department chief position, ultimately cut back on my work schedule. Even after doing that, the effects of the treatment were compromising my ability to provide the best care possible to my patients. And so after a lot of thought with myself and my family, I decided to go on permanent disability.
There's been downsides to you being disabled. We all know that. Has there been upsides?
Although it was difficult to give up the practice, I have found many rewarding benefits of being home all the time. My children were young enough that I was still able to participate in their upbringing, more so than I was able to do working full-time as a doctor. I'll claim that it benefited their upbringing, although they may dispute that. They still went through their teenage trials and tribulations, but I felt more fulfilled being able to participate in that. I'm not sure if my wife appreciated me being home all the time, but we sure did spend more time together. It's hard to believe that not too long ago I was diagnosed with the second life-threatening cancer, and last year I had to undergo surgery, chemotherapy, and radiation for that. That was a horrible year, but again, I had the support of my family to help pull me through to this point where I kind of feel back to where I was before last year.
If somebody just found out, a friend of yours who just found out something like yours, and what kinds of advice would you give them?
If someone I knew or cared about were to be diagnosed with a similar condition or be faced with similar decisions as myself, I would like to say to them that, first of all, I think it's key to have someone giving you advice who is familiar with the options available and who can also help you navigate through the Social Security, long-term disability through the state, and having it tailored is very important.
Do you have anything else, closing thoughts or things that you want to make sure you got to that we maybe didn't touch on?
I think having my wife totally involved in the decision-making process and in the financial conferences that we've had, having it really personalized to our specific needs or concerns, like about education for our children? Will I have enough to maintain the quality or type of lifestyle that we're used to? It's very important, and those are the kinds of things that allow me to sleep better at night, or even when you're lying in your hospital bed, having the reassurance that things are taken care of is very comforting and helps in the recovery process. Knowing that the safety net is there, even if I'm not here, that's just one big burden not to worry about.
So 10 or 15 years ago, looking back, if you could go give yourself advice, what would you tell yourself based on what you know today?
The thing that Karen and I keep reflecting on is how crucial to our well-being joining Kaiser was, because I know of no other healthcare provider where the physicians have this type of care, who are allowed to have this type of security that I'm in the position I am now. As far as other financial decisions, we tend to be very frugal financially, so often maybe we miss the boat sometimes, not doing things financially. If the decision is to spend money or not to spend money, our default is to not spend the money. But as far as how to approach the future, I don't regret what I did when I look back on it now.
Miles, thank you so much for your time and honesty in talking about this difficult experience. I appreciate your courage in speaking so openly about it. I'm Rick Watson with Eagle West, and you've been listening to Miles Tashima. Thanks again.